Hello, I'm one of the staff members at IMCES, the Institute for Multicultural Counseling and Education Services. Our community clinic is reaching out to the community to inform everyone about the coronavirus in a simple way. Today, I'm going to answer some frequently asked questions about COVID-19 testing. All right, let's start with signing up for a test. Should I contact my healthcare provider first for a test? Yes. It's always best to work with your healthcare provider. Unless you have specific symptoms, exposure, or risk factors, you may not need to be tested. Your healthcare provider can talk with you about your concerns and help you determine if you need to be tested. If you do not have a doctor, call 211 or visit the 211 LA to get a referral. Is my healthcare provider required to provide me access to COVID-19 testing? Yes, under certain conditions. Healthcare providers are required by the LA County Health Officer order to provide their patients with access to COVID testing if they have symptoms, are part of a public health investigation, or have been in close contact with someone with COVID-19. The health officer order also encourages providers to build private insurance plans for these services whenever possible. Getting a test through your regular healthcare provider will help you get the care you need. If your healthcare provider is unable to give you a test, you can make an appointment for a COVID-19 test at a community test site. When should I get tested? You should get tested if you have symptoms of COVID-19, were asked by LA County Department of Public Health to get a test because of a contact tracing or outbreak investigation, were in close contact with someone who has COVID-19 in the past 2 weeks, work or live in places such as skilled nursing facilities, group homes, residential care facilities, correctional facilities, or homeless shelters, are a person experiencing homelessness, are an essential worker with frequent contacts with the public in the following areas: healthcare, emergency, food and grocery services, factory workers in food and retail, public transportation, and education. Don't have symptoms but believe you may be infected now because you were exposed to people who were sick, were around many people who were not wearing face coverings, and or were not keeping safe distance in the past 2 weeks. Who is considered a close contact of COVID-19? A close contact is anyone exposed to a person with or suspected to have COVID-19 while infectious. Exposures include 1. Being within 6 feet of an infected person for a total of 15 minutes or more within a 24-hour period. Having unprotected contact with an infected person's body fluids and or secretions, for example, being coughed or sneezed on, sharing utensils or saliva, or providing care without wearing appropriate protective equipment. When you are infectious, you can spread COVID-19 to others because it is highly contagious. Someone with COVID-19 is infectious from 2 days before their symptoms first appear until they are no longer required to be isolated, as described in home isolation instructions for people with COVID-19. A person with no symptoms and a positive COVID-19 test is infectious from 2 days before their test was taken until 10 days after their test. Will a COVID-19 test protect me from the virus? No. Even if you have a negative result, you should practice physical distancing, wear a face covering, and wash your hands frequently. A negative COVID test does not guarantee that you do not have the virus. With widespread community transmission, there is a daily risk of being infected with COVID-19. Can I show up to a testing site and see if they have availability? Testing is done by appointment. However, same-day appointments and walk-ins may be available at some testing locations. Please use this website to find a convenient testing location and sign up for a test. Having an appointment helps reduce wait times and helps us ensure that we have enough staff and testing supplies available. What do I do if the site closest to me does not have available appointments? If no appointments are available at your preferred site, check for testing availability at a different location. Appointments are added to the website daily. Check back to see when appointments become available at a location near you. What if I do not have internet access? Can I still get tested for COVID-19? Residents of LA County without internet access can call 211 to speak with an operator who will help you make an appointment. How far in advance can I schedule a test appointment? You can schedule an appointment up to 5 days ahead of time. Same-day appointments may also be available. Are all the sites drive-up? Are there any walk-up sites where I will go inside a facility? Some sites are drive-up and some are walk-up. The map will show you whether it is a drive-up or a walk-up site. Why do you ask for insurance information? Does it cost anything to get a test at a county-operated site? Testing is free for you regardless of insurance or immigration status. When you give your insurance information, it allows the laboratory to bill your insurance to get reimbursed for the cost of the test. According to the state of California, your health plan likely is required to pay for approved COVID-19 tests that meet most of these criteria. People who have symptoms of COVID-19. People who were in close contact with someone with COVID-19 in the past 2 weeks. People working or living in places such as skilled nursing facilities, group homes, residential care facilities, correctional facilities, and persons experiencing homelessness. Are an essential worker with frequent contacts with public in these sectors. Healthcare, emergency services, food and grocery services, food manufacturing, retailer manufacturing, public transportation, and education. What should I do if I get a bill for the test? First, make sure it's a bill. You may receive an explanation of benefits notice from your insurance company. It often arrives in the mail well after the test and looks like a bill, but is not a bill. It will often say, "This is not a bill," on the notice. Do not pay it. If you do receive a bill, contact your insurance company or healthcare provider to inquire about it. You can also contact the California Insurance Commissioner's Office for help or to file a complaint. Call 800-927-4357. Is all COVID-19 testing free? The COVID-19 testing sites on the LA County COVID-19 testing website offers no-cost, free testing. Participating community clinics, providers, and other agencies may ask for your insurance information or ask you to enroll in a government program so that they can get reimbursed for the cost of the test. If you are unable or unwilling to provide this information, some sites may charge a sliding scale fee. The county does not endorse or regulate all COVID-19 testing sites. Please make sure to read and ask about any cost for a COVID-19 test. Why do some registration sites ask for a driver's license or social security number? Is this required? The federal government has approved funding to reimburse healthcare providers and facilities for COVID-19 testing and treatment of the uninsured. We are required to ask you for your insurance information to receive reimbursement. However, you do not need to provide a driver's license or social security number to get a test. COVID-19 testing is available regardless of immigration status. Healthcare providers are not required to confirm immigration status prior to submitting claims for reimbursement. Preparing for your test. Do I need to do anything to prepare for my test appointment? Please do not smoke, vape, eat or drink anything 1 hour before your testing appointment. Bring your appointment confirmation and some form of identification to match the registration information. Your identity and your test results are protected by federal law and will not be shared with any other agencies for purposes of law enforcement or immigration. Please also wear your face covering when you arrive at the testing site. Am I required to show ID? Minors are not required to show identification. Everyone 18 years of age and over should bring some type of personal identification to your test. This helps ensure that your test results are matched to the right person. Your identity and test results are protected by federal law and will not be shared with any other agencies for purposes of law enforcement or immigration. What does the test consist of? How long does it take? We use a PCR test to detect the virus that causes COVID-19. There are many ways to get a sample for the test. You will receive information about the collection method for the site you select in the registration process. We are currently taking samples from the nose, mouth, and throat. Nose. It is very common to get a sample from the nose. There are 2 ways that samples from the nose are being collected. The most common way is for the sample to be taken from the front of the nose. This is a self-administered test, meaning the person taking the test collects this sample on their own. It is much more comfortable than the sample taken from the back of the nose. Most county-operated sites are using this collection method. At some testing sites, the samples are collected from the back of the nose by a trained healthcare professional. This helps to make sure the sample is high quality. There is nothing additional you need to do to prepare. Mouth or oral sample. Most city-operated sites are taking samples from the mouth. It is very important that you follow the instructions carefully for the mouth swab. The quality of the test will depend on how closely you follow the instructions. Throat. Some sites are getting samples from the throat. In most cases, a healthcare professional gets this sample. This helps to make sure that the sample is high quality. In all cases, staff are trained on the collection method used at their site and will help guide you on the process. The testing process takes between 5 to 10 minutes. Can I have other people in my car when I arrive for testing? Yes, but please do not expose others if you suspect you have COVID-19. Only those with confirmed appointments will be tested. All individuals in the car should be wearing appropriate face coverings. I signed up at a drive-up site. Do I have to get out of my car? No. Tests at drive-up sites will be performed while you remain in your vehicle. All right, let's talk about results from your test. How do I follow up on my results? If you have not received the results of your COVID-19 test taken at one of the community testing sites in LA County, please email, call, or visit the website listed for the location where you took your test. How long does it take to get test results? It typically takes between 1 to 3 days to receive your test results. You will be notified by email, text, by phone call, and in some cases by mail, depending on the site. It is very important that you provide accurate and complete information when registering. We use this information to contact you with your results. While waiting for results, it is essential that you wear a mask and maintain social distance. If you are sick, stay home and self-isolate until the results are back. You should arrange for others to provide groceries, medicines, etc. whenever possible to avoid exposing others. If you do not have someone to help you, you can arrange for food and other necessities to be left at your door. If you need help finding food or other necessities, call 211, visit 211la.org, onedegree.org, or the LA County Department of Public Health resource webpage. Even if the test is negative and you are experiencing symptoms, you should remain at home until any fever has resolved and any other symptoms have significantly improved. If you are not improving or feeling worse, contact your doctor or seek medical care. IMCES is a nonprofit community clinic committed to providing direct mental health services to ethnically diverse, underserved communities in Los Angeles. Our mission is promoting human rights, equity, and social justice by reducing disparity and providing access to resources, leveling the ground for all to walk on. We believe that equal access to health and mental health services is the human right of all. For more information, please visit our website, www.imces.org, or call us at 213-381-1250. Please be safely well. Resource: www.covid19.lacounty.gov.